Welcome to America's Heroes Group.
Back to America's Heroes Group. We are globally connected with Kaiser Health News. Today is Saturday, August 20th, 2022. August is National Wellness Month. You just heard our host, Cliff Clay, during the break. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have a great panelist with us now, Aneri Pattani. She's a national correspondent for Kaiser Health News, a nonprofit outlet covering U.S. healthcare and health policy. And we're going to talk about a news article on social media post that criticized 988, the new suicide hotline, for calling the police. What do we need to know about this? Ms. Pattani, how you doing?
I'm doing well, thanks.
So what's happened? I heard that I have talked about this with people in the in our studio. There was an incident recently where someone was had the police called on them when they tried to get help on 988. So what's going on here, and how does that work?
So 988 is the new 3-digit number for the National Suicide Prevention Lifeline. So this is a hotline that has existed for many years, but they now have given it a shorter number so that it's easier for people to remember and access. And the idea is it's the alternative to 911 for mental health emergencies. And so the idea in setting it up is that you don't call police for these sorts of emergencies. If someone is having a breakdown or is struggling with mental illness, that you'd have a different response for them. What's the sort of caveat to this, though, is, and what folks have been talking about on social media and raising concerns about, is if you call 988, the hotline, and they think you're at imminent risk to hurt yourself or someone else, like it's going to happen right away, they, in some cases, may still send police, even if you do not consent. So they try to work with you first and provide other resources and connect you to therapy and get you to agree to a safety plan. But if that doesn't happen, this hotline is one that will then take the step of calling emergency services, which in a lot of places in America that don't have mobile crisis teams of mental health professionals, it means the cops.
So describe to me the mobile response teams that go out, and where are and what cities have these?
So mobile crisis teams are sort of an emerging idea. They're becoming more prevalent, but the idea is these are folks who are trained in mental health. So they might be counselors, they might be therapists, they might be psychiatrists. Their training is specific to de-escalating crises. And these are folks who, would not be armed like police. They're more like mental or healthcare professionals. And in some cities, they respond on their own to emergencies like this. In some cities, they respond alongside police or fire or EMS. And it's really, they're popping up in more places. They tend to be in the larger cities, but some, suburbs, some rural areas may have them as well. But it's definitely not universal. And so that's sort of the first hope, is if someone's in a mental health crisis and the Lifeline needs to send services to their door, that it's a mobile crisis team. But if you don't have those, then that's certainly not an option.
From what I understand, there's only like 2% of calls to 988 typically have some sort of police response or police being sent out to those calls. Does that sound about right?
Yes, that's correct. So like I said, the goal of 988 is to not involve police or any sort of emergency services. The goal is to talk to people. And a lot of calls, frankly, the Lifeline officials say can be handled that way, just by giving someone a person to talk to who's actively listening to them. What are their concerns? Helping them think about, what are reasons to live still? Or, how can I connect you to therapy? Or what are resources in your community? The vast majority of calls can be solved that way. It's in about 2% of calls, which is like roughly 50,000 calls, given the volume of people calling this number. Those are the cases where emergency services get involved. And sometimes, again, emergency services can mean mobile crisis, but also in that 2% is law enforcement.
Okay. And then is there a difference wherein, is it 988 helpful for a child? If, say, a child was going through a crisis, can a child call 988 versus an adult? How do you handle those two different situations?
So anyone can call 988. It is supposed to be sort of universally helpful. You don't have to be an adult. You don't have to be a citizen, anything in particular. They won't ask you information. They might ask you your name just so they know how to address you, but the counselor who answers the call is going to help anyone. And so you can be the person in crisis calling, but you can also be like the friend or family member of someone in crisis and call 988 to get advice or guidance about like how you should help your friend or family member. So it's supposed to be, universally accessible to everyone.
Okay. And so are people warming up to 988? Have they been using it more as numbers going up as far as calls you're getting, things like that?
Yeah, so in the first week after 988, the new 3-digit number came out, and it just came out last month in July. So the first week that it premiered, the call volume went up 45%.
Wow.
So there was a huge uptick. That has settled down a little bit since then. And I think in speaking with folks, what they think happened is a lot of people wanted to test out the new hotline, right? If I call it, is someone going to answer? How does it work? Is someone there? That being said, though, there's going to be a lot more awareness campaigns moving forward to let people know about 988. And so a lot of the call centers are expecting, more and more call volume over time. And that's something they are and will continue having to work on to be prepared to answer that volume of calls.
So what's the typical call when did you get from 988? I'm not sure if you have that information, maybe if you work with 988 directly, but when people call in, what are the typical things that they're calling about?
So what the 988 folks have told me is, it's sort of a range. So one thing that surprises folks is 35% of calls don't have to do with suicide at all. They're just other mental health concerns that people have. So it might be depression, it might be anxiety, it could be a particular diagnosis, it could just be I'm having a panic attack in this moment, or I've had so much anxiety I haven't been able to sleep for 3 days. So it really can run the gamut. And then of course there's a subset of calls where folks are dealing with thoughts of suicide, and that can again run a wide spectrum. There are folks who are thinking about it but not actively planning, and they just need someone to talk to. There are folks who are more in danger of harming themselves, and so the Lifeline is really, they do try to train their counselors to be able to manage a variety of different mental emotional crises.
And then what do you think we need to do to get more awareness about mental health so that people are more apt to reach out for help? Do people wait too long sometimes to call 988?
So I don't have data on that, but from I've been covering mental health for a while now, and all the folks I've spoken to, yes, I think by and large, in our country, mental health is becoming less stigmatized, but it has been for so long, and it continues to be, and particularly for different communities who might be dealing with other, marginalization, reaching out for mental health care is hard. And so sometimes people are not reaching out until they're at that point of crisis. And it's great that we have 988 as a crisis hotline. But in an ideal world, right, we'd focus earlier when people start feeling symptoms of anxiety or depression, or when they start understanding things are going wrong. They would maybe reach out to, if it's a child, a school counselor or a nurse or something to that effect. If it's an adult, then maybe it's a clergy member, maybe it's family and friends, maybe it's going out to seek a therapist, or a social worker, or your community health center, kind of whatever those supports are. We'd have more of that. And if we got to it at an earlier stage, then we'd end up with less folks needing a crisis hotline because we could address it earlier. But I think we're still a ways away from that. And it's not just stigma and people choosing to reach out. Of course, it's also being able to afford services, having insurance that will cover those services, having enough providers. We frankly just don't have enough mental health providers in our country to care for everyone who needs it. So there are a lot of other barriers that we need to address. But if we did that, maybe we'd actually decrease the need for 988, which would be wonderful. I'm sure the folks at 988 would agree as well.
So what are some of the things you want us to know about 988? What are some of the particular things that you have in your mind to talk about?
So people should definitely know that 988 is a resource for everyone. It is 24/7. It is free. It's confidential. The idea is if anyone is in emotional distress, or again, someone in emotional distress, this can be your go-to. So the same way that we learn to call 911 for other emergencies, 988 can be that option. So just letting people know that it exists, I think, is really the biggest first step. And then really the idea with 988 is that it's the first step in reimagining the mental health care system. So right now, the federal government has given about $400 million to call centers all across the country to try to increase their services and answer the calls that come into 988. But ideally, we would also have what mental health advocates are hoping is that when 988 becomes more prominent and people are using it, we will then start investing in services so that when someone calls, can we refer them to therapy in their neighborhood, in their community, in a way that's accessible? If they do need some immediate care, rather than sending them to a hospital emergency room that may be overfilled and not able to help them, where they have to stay for days, can we instead have a crisis stabilization center, just like a place that feels more homey and comfortable, where they can stay for a little while with someone who can help them through that point of crisis? So we don't have all those things in place now, but the idea with 988 is to kind of take that first step, and then hopefully that will lead to more funding to create this whole continuum of care for people when it comes to mental health.
Do you see a difference with veterans who use 988 or call 988 when you talk to them versus the regular civilian population?
So I don't think I've spoken with enough to kind of know if there's a difference. One thing that veterans should know is that the Veterans Crisis Line, so folks who are specifically trained in military culture and to be more responsive to that group, you can access them by calling 988 and then pressing 1. So you call 988 and then you press 1 to get folks who are specifically trained to help with the veteran population.
That's good to know. It's very good to know. So tell us more about what you see 988 evolving into. So this is the first step you mentioned of trying to broaden the conversation, get people more aware, destigmatize the idea of mental health as well, and just reach out if you're feeling like you're feeling anxiety or feeling bad. You don't have to wait to the last minute. Go get the help right now. How do you see this 988 being the next? What's the next step after 988 to get more in control of mental health in this country?
Yeah, so I think one of the biggest things that they've even run into with 988 is building a workforce that can respond to mental health issues. So with 988, that means having counselors who can pick up the phone. So not everyone, the people who answer the phone are not necessarily psychiatrists or psychologists, right? But they are trained in de-escalating crises. They're trained in understanding mental illness and the biological aspects of it and how to be an active listener. And that's a really tough job to be the person answering the phone and talking to folks often in the hardest times of their lives. So trying to build up that workforce is one piece. The next step is the workforce of therapists, and are there therapists who different people can identify with, right? If you're a veteran, do you want a therapist who understands the military background? If you're a person of color, do you want someone who understands what that feels like to be a person of color in America? And X, Y, and Z, whatever your experience is. But we don't have the staff to meet the need to begin with. And then when you add on these extra layers of mental health staff who can be responsive to different communities, we really don't have that. So there is a lot of work to try to build pipelines to get more staff in these positions, whether it's licensed therapists, psychologists, psychiatrists, and kind of some of those routes that they're looking at are, repaying student loan programs, scholarships, fellowships, but different ways to really encourage more folks to get into this field because we have such a need.
So you mentioned programs like college repayment and for your college loans and things like that. What else do we need to do to get more people and to broaden this industry?
Well, so one of the biggest obstacles that I often hear from therapists is that reimbursement for their services versus a physical medical doctor tends to be much lower. And so a lot of therapists don't accept insurance because they say it's more expensive for them to process the insurance paperwork than the insurance payments they get back.
Wow.
And so what they want to fix that is insurance, both public programs through the government and private insurers, to pay rates that are more comparable to what we pay for physical ailments and physical care. And there's a Mental Health Parity Act that's been in place since 2008, federal law that tries to make sure that happens. But enforcing it is hard, and that's still something that folks are working on. So that's kind of more of a policy funding piece that needs to be fixed. But that would help therapists draw more people to the field, keep them in business, and make sure that they take insurance so that if you or I or someone goes to them, that person doesn't have to pay out of pocket, because then a lot of patients can't afford therapy.
Wow, that's something I didn't realize. I mean, so if therapists and people that work in this field are not even using or accepting insurance because it pays too little. That's crazy.
Yeah, a lot of therapists are doing that.
Wow. So what else do we need to know about this topic, particularly 988, and the benefits that it provides to the community? Yeah,
I mean, I think the idea is that this is for everyone to reach out when you need anything. And one thing that a counselor said to me is, what's a crisis for one person can be totally different from another person. So people shouldn't think, if I call the line, it's not bad enough yet. I don't need to call the line. Someone else needs it more than me. That's not what they're hoping for. They're really hoping that folks reach out, even if it is earlier, or what may feel like. Don't talk yourself out of it. Essentially, don't tell yourself your problem is not big. The Lifeline is there to help folks, and they do really want individuals to call. It's not just for the absolute worst crisis you can think of. It's meant for people in any level of mental health, emotional distress to call and have this resource.
So going back again, making sure you don't wait to the last minute or the 11th hour to try to get help. Get help when you need it. Get help when you feel like you need it. Because that's probably one of the things that people are having in the back of their head, is that they think we're kind of trained to think about 911. Like, you only call that when it's a real serious emergency. But 988 is something that's designed for you to help people. Now, you
exactly.
And you mentioned you could call for other people as well. So you can call for someone else if you see someone maybe that's not maybe that needs help. You can call on behalf of someone else.
Yes, you can. And so if you called on behalf of someone else, what the counselor might do is sort of offer you suggestions of how you could help that individual. They might offer to call that individual if you think the person would be open to that. Of course, if they're not going to call them without you saying so or giving them their number. But they can offer suggestions of how you can support the person in crisis. And the other thing I realized important to mention is that the goal with 988 is to connect folks to local resources. So there are more than 200 call centers across the country that answer the calls for 988. And the hope is that when you call, you're routed to a center close to you so that they can say, here is a, mental health clinician in your community. Or even if it's something like, I need housing assistance, and what's causing my anxiety is the concern that I will be, kicked out, I can't make rent, then maybe they can connect you with a local housing assistance agency in your area who can help. So the goal is really to localize that crisis response.
And that's the thing I think is really critical, that piece of connecting people to resources and referrals in their local communities, because mental health connects to so many other social issues like homelessness. I mean, beyond suicide, it's homelessness and as a huge thing. Domestic violence, domestic abuse, people that hurt themselves. So 988 could really, hopefully it becomes this really powerful tool to help people really get connected to the things around them in their areas and their communities. Now, how does this translate from the city, from urban areas to rural areas? Because the resources in an urban area might be a lot different than what's in the rural communities.
Yeah, absolutely. 988 is available everywhere. It's the same way as 911. Doesn't matter where you're located, you can call them. They'll still try to get you to the closest call center. If the call center near you is in the city, generally the idea is those counselors who are answering the phone should be trained and able to connect you to resources even in the more rural or suburban areas of the state. And if those call centers are busy or for some reason understaffed, there are national backup call centers. So those are still in place to answer the phone. And even if they don't know the local community as well as the local call center, they can a lot of these call centers are in touch with, 211 and city services and nonprofits. So the idea is they will do their best to link you to services that you need.
Aneri Pattani, she is a national correspondent for Kaiser Health News, a nonprofit outlet covering U.S. healthcare and health policy. We appreciate your time.
Thank you so much for having me.
This is America's Heroes Group. We'll be right back.